cut you off. So we don't want our podcast cut off. The radio won't cut off. We'll keep going on the radio, but we want our listeners to see. So let's put our headphones on. All right, Chattanooga. How are you? I don't have the live button on air. Okay, let me know. All right, Chattanooga. This is your talk show host, Dr. Eleanor Woods, with what's happening in your neck of the woods. Boy, I tell you, down here at WPTP, we have so much going on all through the week, and I'm telling you, this is one big week. And this is the conclusion of Women's History Month, and so how befitting to have one of Chattanooga's own best child pedodontists here in the house with us today, Dr. LaTasha Garrett.
Hello.
She is here. I am so excited. She is our featured woman of the month. And let me tell you, we go way back, don't we?
We do.
We go way back. I am so proud of her. LaTasha Garrett is the first African-American female pedodontist, and she is the only African-American pedodontist in the entire city of Chattanooga. And so we salute you.
Thank you.
We salute you. So tell us a little bit about you, LaTasha, and just a little background to give us a feel, because we got a lot of folk that have children that they're looking for a dentist to take them to, and then we have a lot of people who are afraid of the dentist themselves, and they want that type of person that they can bond with and that they can get a relationship with. So just tell us a little bit about you, so get us warmed up, and then we'll go into what you do.
So I was born and raised in Chattanooga, Tennessee. I left here in 2001 after high school and attended University of Tennessee at Knoxville, where I received my bachelor's and my master's degree in chemistry. From there, I came back and worked briefly in Chattanooga as a chemist and decided that I wanted to go to dental school. Actually, after working with Dr. Woods on Saturdays at her second practice in Jasper, Tennessee. And so dental school was great for the 4 years. I just loved it and enjoyed it. And I found that I really enjoyed working with kids, even though a lot of my adult patients will say that they ran me to kids because they were so afraid of the dentist.
Yes.
But from there, I went straight to Maryland, where I did my pediatric dentistry residency, and then I moved back to Nashville after that, and I worked 5 years as an associate pediatric dentist there, and then I decided I wanted to come back home and start my own practice and build a practice from scratch.
Wow, I'm so proud of you.
I'm back home as of 2020.
Yes, I'm so proud, because it's very seldom that we have an opportunity to really mentor young people when we're in the profession of dentistry, because not a whole lot of people, especially in the African American community, are interested in dentistry. And so when I found that person like yourself who really, really wanted to be a dentist, I was like, oh, this is my opportunity to really help bring somebody into our profession. And she's a woman. So we make up a very small percentage, women in general, in dentistry, a very small point something, I don't know. It's a very small percentage of women in dentistry, and then even smaller African American women in dentistry. So I consider her to be an outstanding doctor, that she went through all of that. And it's nice to know that you went to UT Knoxville too, because that's where I graduated. And we have something in common there. We both have our degrees there. Chemistry and biology were my majors, and she went on and got her master's in chemistry at UT, and then she finished at UT Memphis, which is where I went to dental school. One of the best dental schools. So I know if you attended UT Memphis, you got to be the absolute best, because they take us through it, don't they?
They do.
They take us through it, and then she went on to become a child dentist, which is even more special. So tell us a little bit about what separates you as a child dentist, and what type of patients do you see? Because a lot of people don't know that you see other types of patients other than just children. And tell us a little bit about what separates you from the general dentist like myself, and you are a specialist in child care dentistry. So just tell us a little bit about what separates you and some of the stuff that you do.
So I see children ages 0 to 18. we see all children, even special needs, kids that are medically compromised. One thing that separates me from the general dentist is that the additional training allows us to treat the kids that can't just sit in the chair. So if you've tried all your behavior management, tell, show, do, trying distractions, putting the TVs up, and they still can't cooperate, or they're special needs and they can't cooperate, what do you do next? So we offer nitrous, which is also known as the laughing gas. I also offer oral sedation, which is just a conscious sedation where they come in, they drink medicine, it just kind of helps them to relax so that we can get treatment done. And then I also have privileges at Erlanger Children's Hospital where the pediatric anesthesiologist puts the kids to sleep, and then I can operate and do all the treatment in one visit.
That's awesome. And for 4 years I saw children only, and when I went corporate, and it is something to treat those little babies. I'm talking about as young as 6 months to 8 months. They barely got teeth, but they're rotten, and you're trying to take care of children that are that small in a regular setting. It's almost impossible. And so we had to put children to sleep most of the time. And so if you had some advice, because this is where we run into the issue, why do children end up in your office in the first place with a bad experience versus a good experience? Like, what age should they start coming to the dentist? And then what type of things, dietary recommendations do you have for little children to keep them from getting these cavities? Because, they have abscesses like grown people, and we have some that have died. So tell us a little bit about that. What recommendation or suggestions do you have for parents?
So the new recommendation now is to see the child as soon as the first tooth erupts, or at least by the age of 1. So the goal is, a lot of times parents are like, well, they don't really have any teeth. The goal is to do that anticipatory guidance to try to prevent decay, to try to establish what is the caries risk. Are they going to sleep with a bottle at night? Are they going to sleep with a sippy cup with juice? Are the parents brushing? Are they using training toothpaste? Are they using fluoridated toothpaste? So that's our time to have that discussion with them to try to prevent decay, and also to just establish a dental home so that they have a place to go for when they start to walk and they fall and they chip their tooth, and it's Saturday and it's 8 o'clock at night, they have someone to call. Right.
So if a child falls or something, or injures themselves, because they're outside, they're riding their bikes, they're skating, they're doing all kind of activities, that accidents happen, and a tooth should come out. We've seen that happen. It's a whole tooth just come out. What do you suggest the parents do if a whole tooth just comes out, or if they break it in half and they see something red, which is the nerve? What do you suggest that they do? It's a Saturday and Sunday. All the dentist offices are closed. What should they do?
Well, if it's a primary tooth or a baby tooth, leave it out. Don't put it back in. Usually if it's a baby tooth, you usually could probably wait until the dental office opens. If it's a permanent tooth, you want to put the tooth in cold milk and try to get to the emergency room to where someone can put the tooth in as soon as possible. Sometimes there's, if you go to the Erlanger Children's Hospital, there's always a dentist on call. We rotate and take the call. So if an emergency doctor is there and someone comes in with a volts tooth, they will call us so that we can get that tooth in as soon as possible. The quicker the tooth is put back in, the more likely that the tooth will remain and the body accepts it.
So you're talking about re-implanting the tooth. The word that she used was avulsed, A-V-U-L-S-E-D. That means the tooth comes completely out. You see the root and everything. So she's saying that you take the tooth and put it in cold milk and then go to the emergency room immediately where someone can assist them with putting the tooth back in.
Correct.
And so the nerves are still in the tooth, and you can do a root canal perhaps if the tooth goes into a situation where it was shocked so bad that the nerve starts to deteriorate, but they'll get to keep the tooth, right? So that's subjective to save the teeth. So now let's talk about these children when they come in the office. So what are some of the things that's different in the environment from the regular dentist and the pedodontist dentist, which is why children should come? Because I got 2 little babies, and I put my 1-year-old in my chair, and it was hands off. It was just hands off. I said, you know what? You're going to Dr. Garrett. And so what is it that makes children really love and adapt so easy to your office? What are some of the things that you do for your little babies and your little children patients that make it more inviting?
So when they first enter, I feel like the environment is already more of a kid environment. There's animals on the wall. Obviously, the giraffe is our logo. When they come in, there's televisions on the ceiling. So right now we're playing Encanto, which is a big hit. All the kids are distracted with Encanto, especially the songs that are featured.
Yeah, my baby listens to that too. She was looking at it yesterday.
I listen to it. I sing to them. The staff sings to them. And then a lot of it is just having a little patience and walking them through because they don't know what to expect. A lot of times, especially if the parents have anxiety, if they've gone to the doctor and they're like afraid of shots. So most of it is like, this is what you're going to expect when you come. And so we try to like stay calm, walk them through those steps, and just be patient with them. The parents also get to stay with them, and so I feel like having mom and dad there, that also kind of makes things a little bit more comfortable. So
now, at the facility that I worked for 4 years of my career, we used the papoose board. Do you use the papoose board at your office? And explain what the papoose board is and what are some of the downsides to the papoose board? Because I didn't like the papoose board.
I don't like the papoose board. So it's a board that's flat that the kids will lay flat on, and then it has Velcro straps that basically strap the kid into place so that they can't move. And mainly it's to protect the staff, to protect the patient, because we're using instruments that are sharp, and sometimes if they move or if they grab something, then they could get hurt. I personally don't use the papoose anymore. I used it at my last job only for sedation. We wouldn't put the straps on them unless it was like we were in the procedure and we're telling the parents, hey, we may have to do it because they're sedated, then they feel relaxed, they're moving their arms. We may be close to the end and now they're done with the appointment and we just need to safely finish. Personally now, I tell the parents I'm not holding them down. If I start something, I'm just going to try to get to a safe part of the procedure where I can stop, and then we're going to look at going to the hospital or other options to do it safely.
And I think that is one thing that sets children doctors or pedodontists aside from general practitioners. She already has privileges at Erlanger's Children's Hospital. So if a child cannot be managed in her office, then rather than tie them down, which is legal, I should tell parents that's legal with permission from the parents, then she can just simply put your child all the way to sleep. And so I like that, and I think most parents feel comfortable with putting their children to sleep versus having them strapped down, which I'm not saying that's not a good idea. I'm just saying that there are some parents that don't want that, and there are some doctors that don't prefer to do treatment with the children papoose down. So what are some of the biggest challenges that you have with children? Or some of the things that you feel that parents need to know that has been some of your worst case scenarios?
I feel like there's a lot of high anxiety, and a lot of times it's because the parents have high anxiety, and they'll say it when they come in. They're like, he's scared, and it's probably because I'm scared, and he can sense that I'm scared. And so usually at that first visit, if they're nervous, sometimes we may not be able to do a cleaning and fluoride and take x-rays. Sometimes it may just be introducing the mirror and just taking a look in the mouth and letting them sit up and just trying to desensitize them and the parents to become more comfortable and developing a rapport with them. So I feel like that's been like the major thing. And when they come in and they're super anxious like that, usually I'm telling the parents, like, we have to be positive. It may help to lay them back at the dentist, like they are at the dentist, kind of lay them down at home and brush their teeth to practice. There's different shows that kind of like go to the dentist, like Daniel the Tiger. There's YouTube videos. A lot of the parents and kids will say, well, we went to your website and I have a commercial on there. And so a lot of them were like, oh, we saw the commercial and you looked at the elephant's teeth with the mirror.
Right.
So I feel like there's much positive things we can show them, that the dentist isn't scary. You're not getting shots, because that's where they're coming in like, oh my gosh, they just had shots at the doctor. I don't want a shot. and they're just afraid. So usually that's like the biggest challenge because, you know, with kids, you're still doing general dentistry, but you're just trying to figure out a way to handle the behavior management.
Yeah, and they can't handle a lot. You know, the children, like when they go to the physician and the physician gives them their vaccination, it's kind of like a shot and they're out. When we give them a shot in the dental chair, it's a shot and you got to stay because now we got to perform surgery because everything is surgery. When we cut on the tooth, it's surgery. So now we've got to maintain them beyond the shot versus when they get their vaccination, they cry and they're gone on, they're welling on out the door. So it is very important then, as you were saying, that parents do positive reinforcement and tell positive stories instead of saying, you're going to get a shot. They got a big needle this big. It's going to come out. It'll shoot you in the mouth. The kids,
take out your tooth.
they're going to pull your tooth out, you know. And they got this image of the dentist of like a dragon or something, big monster that's going to come to them. So when they sit in the chair, they start crying. So that's good. I'm glad you shared that with us because parents need to know that. And so tell us where you're located.
I'm located at 6413 Lee Hwy Suite 119. If you're familiar with Miller Mott's Community College, Venue Church, I'm in that same plaza on
Okay.
the highway.
And people want to know what type of insurance you accept because that's really big with children. There's all kinds of insurances that are out there. And then so we need to know what type of insurances you accept. Is it all or you don't accept some or just what?
I accept all insurances, so pretty much Tennessee and Georgia Medicaid. I accept all PPO insurances. There are a couple that I am out of network with, but for the most part, we accept all PPO insurances. For the patients that do not have insurance, we also offer a membership plan where the parents will pay $250 per child, and that includes unlimited x-rays, it includes 2 prophies, 2 exams, 2 fluoride treatments,
Wow.
1 unlimited exam, and then they get 30% off of all restorative procedures, and I also discount the silver diamond fluoride down to $10 per tube.
Whoa, they make me want to be a child. Oh my God, because x-rays themselves are $100 to $200. You know, so that's fantastic. So I know that you got a lot going on today with your family, but I just want to first of all thank you. Thank you for coming by and sharing with us your practice. We're going to do everything that we can to highlight you the rest of this month and periodically talk about you on the radio because people don't know that you're here. And I'm so proud of you. I mean, this is Chattanooga's first and only African-American female pedodontist. Did y'all hear me? Pedodontist ever in the history of Chattanooga. And that's worth celebrating. And that's why you are our pick for Women's History Month of the month, history. So we appreciate you for coming on. And we've got your brochures. We're going to do everything that we can to promote you. And then we'll talk about what we can do to put you on our website to kind of promote you that way. And then time to time we'll have you on the show to talk about more stuff. Okay? Well, thank you so much for coming on.
I appreciate it.
Yes, and we're going to go to a break, y'all. That's Dr. LaTasha Garrett, who is a pedodontist in Chattanooga. You got to go see her. She's located one more time, and then your phone number.
6413 Lee Hwy Suite 119. The phone number is 423-888-3004.
All right, you all heard it. So thank you so much. We're going to take a break, and then we will be right back. All right, thank you for coming on. I got you done.
You did.
Okay, and I got to tell you my soror too. Yes, yes. So we're excited. So we'll take these and we're gonna pass these out. And when we have guests, they come in. We got all kind of people stuff here, and we will make sure that people.
Yeah,
know
I didn't even
you're
notice
here.
him.
Yes, and later on this evening, I know y'all are gonna be busy, but we got the big concert.
What time is the concert?
It's gonna start around 5 or 5:30 to 6:30. Yeah, I know y'all still be right in the middle. Y'all be right in the middle.
Already like,
Yeah.
4 until.
Right, exactly.
You're gonna be sleeping 9.
You know it. You know it. Thank you so much. All right, bye-bye. Be safe. Okay, is my watch still live on Facebook? Okay, all right. Okay, I'm gonna get my I'm gonna step away from the camera for just a moment to get my phone because I need to talk about the event that's going on. And I'm gonna wrap it up. Yes. You got your hair cut, or you just always have your hat on?
Maybe I don't know.
Okay. I never noticed. I think you always have your hat on. I never paid attention. Okay. All right. So we're back in the saddle here. Let me pull this up. Chattanooga. We got it going on here at WPTP today. I know you all know because it's been all over the city. Jimmy Allgood is going to launch his new record label today. So we're excited about that. I'm going to give you all a lowdown on what's going to be happening today. All right, let's go to it. You all did get my email, right? Yeah. Okay, good. Okay, so we're back on the set. Thank you all for staying on while we took our break. So today, it is Jimmy Allgood Day. And we have a big lineup today, starting at 4:30. We're going to have a press conference right here in the studio. And we're going to have Jimmy Allgood's record label signing. And we're going to have a message from Fever International Music Group brought live here from New York from his managing team, Mr. T.C. Page. And then we're going to have a message from Alden Park Development Corporation and WPTP 100.1, how we got here. And then a message from our artist, Jimmy Allgood. He's going to talk about his career and moving from where he was to where he is now and what we can expect from him moving forward. And I'd like to just give a shout out to our visual architect from number 89 Photography, who's going to be recording and keeping all of this history intact for us today. Mr. Reginald Clack is our video photographer, but he likes to be called a visual architect because he doesn't just take pictures. He creates memories and moments. Also, we have our logistics and our WPTP 100.1 FM radio engineers, Gil Weidman and Mr. Charlton McCullum, and our marketing director, Michael Slyman, who is doing a whole lot for WPTP with getting our radio station brand developed and out there in the community so you all recognize and know who we are. And then we're going to have a concert starting at about 5:30. And it's going to be featuring Jimmy Allgood with special performance by Denise Dave. I cannot wait. They've been doing sound checks all day yesterday, I believe, engineers. So the mics and the speakers are ready. We are excited. Our mistress of ceremony today is WPTP founder and CEO, Dr. Eleanor Woods, myself, and talk show host, celebrity Doll Sandridge with Flavor for Doll. And our event hostess for today is Eloquent Marketing and Management with co-founders Amy Chubb, Doll Sandridge, Kanisha Seals, and also Justine Jones and Anita Menifee are additional WPTP 100.1 FM radio. a hostess, and we will have a little reception also that's catered by Herman Soul Food and Restaurant. And I'd like to give a shout out to all of our talk show hosts. Mr. Napoleon Donut William, you all know him. He hosts the show The Blues Is All Right every Monday from 3 to 6. We also have Miss Tanisha Rutledge, who is Miss LOL. You all know her. She hosts the show every Monday and every Wednesday. Is that correct? Monday and Wednesday from 6 to 7. And also we have Doll Sandridge with Flavor for Doll. She comes on every Wednesday. And let me just say this Wednesday we will have on her show the district attorney, I would call her a candidate that's seeking the position of district attorney, Miss Cody Womp on the show. And then next Wednesday on her show, we will have District Attorney Neil Pinkston, who is seeking re-election. And then the following Wednesday, hopefully we'll have Mr. Brook. We are still trying to get him on. So that's a heated race. And so that show, y'all be sure to tune in for her show this Wednesday and the following 2 Wednesdays. We also have Mr. Antonio Boston, who hosts the show Chattanooga Connection and Community Tea. You all also know him as, what does he call himself? The Celebrity Hype Man. So he comes on every Saturday from 12 to 1. And then, of course, we also have Pastor Paul Warfield that comes on Wednesday, every Wednesday at 4:30 to 5:30 with Real Talk. And then, of course, me every Saturday from 1 to 2 o'clock. You can hear us on a radio station anywhere in the world at WPTP 1001fm.com. We also have our social media platforms. We're now available on Facebook, Instagram, and also aren't we also available on what is it? I can't remember now. It's the other one. Well, the internet, yes. YouTube, yes. We're also on YouTube now. Yes, we have a YouTube account, yes. That became available as of this past week. So, y'all, we're doing it here at WPTP. We're excited. Michael Slyman is our marketing director. He's doing a wonderful job. And, of course, our engineers keep us on the air. They are amazing. Gil and Charlton are just amazing 2 men that if they're not here keeping it going, we wouldn't be on the air. So I just like to give a shout out to both of them for what they do here at WPTP Radio. And of course, I like to give a shout out to Alton Park Development Corporation because they are our parent company. We are a 501c3 nonprofit organization. And my vice president, Cassandra Weidman, my right hand, I'm her right hand, she my right hand, and she got her eyelashes on, and I got my eyelashes on. Don't mess with my best friend. I love her, and I thank her for being here for us with Alton Park Development Corporation and filling in all the gaps, because you all know I practice dentistry every day. So I have to have an incredible team. And shout out to our past and immediate president, Mr. George Calhoun, for keeping Alton Park Development Corporation alive and going for all of these years, and all the people who are part of this great organization. I want to give a big, big, big shout out to Chattanooga News Chronicle, because we partnered together, and you all know without the media, our story wouldn't get told. So I want to give a shout out to Mr. and Mrs. John Edwards and Faith Edwards for doing what they've done for so many years. They are legends in this community, and I appreciate everything that they're doing for our community and for partnering with WPTP to make sure that the African American and Black community voice does not die, and that our story gets told, and it gets told the right way. So hats off to you guys wherever you are. Thank you so much for that. So if you want to be at our event today, it is RSVP only, because we have to make sure that everything's secured here. We've got a lot of VIP, very important people here today. A lot of dignitaries are here today. And we do have security on site. And so for those who would like to attend, it might be a little too late because I think we've reached our maximum capacity. But anyway, give us a call anyway. You don't know, you might until you check. So I want to thank all of you for supporting Autumn Park Development Corporation. I do want to remind you that this organization has a budget proposal that is before the county mayor and the county commissioners, and also before the city mayor, Tim Kelly and Jim Coppinger as well, for this community. We haven't had a huge investment in the black community probably for more than 30 years. I know the last big investment we had was the Hope 6 grant. So we are seeking some support, not just for Autumn Park Development Corporation, but the programs that are part of that budget takes care of the African American and black community and minority community, those who are the least of us. So I want you all to support that budget. If you'd like to see a copy of the budget, we're going to make that budget available on our website for you to look at. We have a lot of people involved with putting that budget together in the community and that are part of that budget. And so we want you all to be there for us when we go before the county and when we go before the city for support. So I do understand that the county mayor is seriously considering supporting us as he and the mayor are working together on this budget. But it's a budget that will help us in our community with crime, education, you name it, our youth, keeping the footprint of the African American community in Chattanooga and not losing that footprint. It involves some things that most of us have sought for a long time, workforce development, you name it, it's part of that package. So we will be making that available on our website. We have a nice video presentation and a PowerPoint presentation that we put on for our county mayor, and we would like for the city to be privileged to that because it's all about you. It's not about any individual. It's about the entire community. So I just want to put that out. So when you see that $3.5 million budget, which is well overdue and well under the amount that this community needs, it's just a small piece of what our community needs to get things started. We have asked for funding for a school for the trades. And so we want to make sure that we're not stepping on anybody's toes. It's just that there is a segment of the population that will be left out. And we want to make sure that it's not our community that's left out because we're the ones that really need the trades. As you all know, Kerwin was closed down and it benefited African American and the black community. And we want to make sure that when the trade schools comes back, which it is, that we're not left out of the equation. So we're going to be partnering, asking for partnership, put it that way, with Ken Hayes and the whole group over there. Thank you all for doing such a wonderful job over there in Avondale with getting that school started. We need it. I'm gathering even more information about how do you qualify to be a student. We know that there are 146 seats for high school students only, and 60 seats are for those who are in the community. And I've been getting some breakdown on who qualifies and what will disqualify you, which does concern us. And so we'll be talking about that later as I get more specific information about that. Thanks to Commissioner Mackey for putting some things together to get it done, and for getting, and all the county commissioners that were part of that, and the school board for seeing that Chattanooga Hamilton County got a trade school back in our community. Now we need to make it work for all people. So I want to thank you all. Stay tuned. Come back to us at 4:30 as we'll go live, and we'll be live streaming all around the world and in Chattanooga for this very important press conference and EP release party. And for Jimmy Allgood, we love you out there. They've been putting together some good stuff. I understand they've been practicing on stage and checking the sound, and it's all pretty in there and decorated. Kudos goes out especially to the eloquent marketing team for being a part of making sure that the logistics are carried through correctly. And also shout out to Rodney Billups with Herman's Soul Food restaurant. And you all know he brings it, so we're going to eat real good this afternoon. And thank you for all the dignitaries that have agreed to come today to make this day so special for our own native Jimmy Allgood. So Jimmy Allgood, you all that in a bag of chips. And we love you and best wishes to you today. Y'all have a great day. I'll see you at 4:30. All right. Awesome.